Hello, my name is Michele Kroll, and I am an older adult health and well-being field specialist for the University of New Hampshire Cooperative Extension. I just finished 3 years in this position, but I came to UNH Extension with 30 years of previous extension experience from the University of Missouri. In my career, I have held several different positions within Extension, as well as worked in 3 different Extension systems. I completed my PhD 2 years ago in learning technologies and design, and have tried to incorporate e-learning pedagogy and learning technologies such as virtual reality, rehab digital health systems for access to healthcare in rural areas. Using innovative research and program design has allowed me to serve a wider audience and focus on older adult health and well-being needs across the state. When I began with this position, I was tasked with completing a needs assessment and finding gaps for program needs for the older adult population in New Hampshire post-COVID. I wanted to provide proactive aging versus reactive aging programs and find a model that would complement the social determinants of health. In doing so, I developed 3 programs that will be highlighted for today's presentation. The Wellness Wheel Assessment is a holistic approach to healthy living and well-being. Boost Your Brain and Memory is a dementia prevention program and rural healthcare access through Extension telehealth hubs. The Wellness Wheel is a tool for self-exploration that can help individuals identify choices or situations that impact their overall well-being. Each of the 8 dimensions are interconnected and equally important. The Wellness Wheel describes the integration of 8 important dimensions of wellness that include emotional, financial, environmental, intellectual, occupational, physical, social, and spiritual. A Wellness Wheel assessment can help individuals identify core health values and goals. The Wellness Wheel is a strength-based model building on people's daily habits and routines while shaping new ones. Adjacent dimensions are connected and reliant on one another, and each dimension can impact one another, both positive or negatively. It was developed by Dr. Peggy Swarbrick to address mental health treatments. I developed the Wellness Wheel model into an interactive personal assessment and web-based tool with visual representation that assesses an individual's perception of their overall wellness. When I researched what was available, most web pages had a link to a PDF that described the wheel and the dimensions, but not as an assessment tool. The responsive dashboard enables individuals to assess their overall wellness in 8 dimensions asynchronously. The assessment asks individuals to answer 5 questions per dimension, while in real time a polar area chart builds a personal data visualization assessment report that individuals can print out. The asynchronous web platform includes an overview of the terms wellness and well-being, description of the 8 dimension of wellness through a video, interactive wellness assessment with a personalized report, an ebook activity guide to understand individual results, reflection exercises, and a step-by-step personal action plan, and links to UNH Extension programs and resources targeting all 8 dimensions to help participants reach their wellness goals. On the top right is the Likert scale ranking system for each assessment question. The lower right is an example of the Wellness Wheel assessment visualization results for an individual. The printout also includes the score for each assessment question, so if an individual decides to take the assessment again in 6 months to see improvement, they can compare scores. On the left is the Wellness Wheel snapshot taken from the 2024 program year. The total number of individual assessments were 11,660 across the country. Within the assessment are several demographic criteria that enable me to analyze Wellness Wheel data by state and by county in New Hampshire, gender, age, employment, and marital status, so that our team can use it as a needs assessment tool to see if our programs are targeting the wellness areas individuals have identified as challenges or needing improvement. The overall total respondent averages resulted in intellectual, social, and spiritual wellness reported as the strongest dimensions, whereas emotional, financial, and environmental wellness were the dimensions that were identified as the most challenging. Boost Your Brain and Memory is a program that was developed by Mather Lifeway's Institute on Aging. This program is unique because it takes a holistic approach to improving brain health, and it's evidence-based. 6 of the 8 dimensions of wellness are incorporated into this program, as each of these topics look at how brain health is affected and the research that supports it. Our objectives are to help participants implement new habits to maintain cognitive health while also practicing new skills for better memory performance and lowering risk towards dementia. Although Alzheimer's is one type of dementia, it is the most common form and the one that older adults worry the most about. I'd like to share some data about why this program is so timely. New Hampshire is the second oldest aging state behind Maine. The number of New Hampshire residents age 65 and older are 20% of the New Hampshire population, and that trajectory continues. 26,500 people age 65 and older are currently living with Alzheimer's in New Hampshire, with 7% aged 45 and older having a risk of cognitive decline, according to the Alzheimer's Association. 48,000 New Hampshire family caregivers provided 77 million hours of unpaid care in 2023. 66% of caregivers reported having at least one chronic health condition, and 29% reported depression. Many of our participants are those that have lived experience from a parent or spouse, or they have retired and they're worried that their intellectual and social capacities are not what they once were. They worry about forgetting things and if that's a normal part of aging. These are some of the most common questions that we get from participants. What's the difference between Alzheimer's disease and dementia? Is dementia a normal part of aging? If a parent or grandparent has dementia, well, I have it too. I can't seem to focus or remember names. I'm forgetful. What does that mean? Do I have dementia? In response to our initial pilot and meeting the need, I developed 2 additional delivery modalities besides in-person: virtual watch parties and the self-study online course. Virtual watch parties are physical sites with participants held around the state with trained facilitators, while myself and another co-instructor teach virtually. This has led to social connection through learning as an unintended result. Some of the participant adoption and behavior changes have included 86% reported that they adopted new brain healthy behaviors, 79% increased connectedness through social engagement and a sense of belonging, and 92% reported being more optimistic about maintaining memory as they age. I'm really excited to share a pioneering project to increase digital equity and access to healthcare for older adults to better age in place. I spent this past year piloting a model for rural community telehealth hubs through county extension offices. Our office is the hub with the digital health systems. I receive training on these systems, and then I work with our healthcare partner to deliver the equipment and train local clinicians and staff to be used in the community. For purposes of the presentation today, telehealth is an umbrella term that describes virtual and digital healthcare. Digital health is the use of information and communication technologies that support the delivery of care across health and health-related fields. This can include electronic patient portals, virtual reality, wearables, robotics, and AI. As digital health has become more pervasive, digital literacy, digital access, and technical support have become necessary to fully access and receive appropriate health care. Through a partnership with UNH and the Center for Digital Health Innovation, we received a 3-year grant from USDA to purchase digital telehealth equipment to increase access to healthcare in rural communities. This USDA grant only supported purchasing equipment. Connecting communities, building partnerships, and providing training for digital health systems is a role each community partner fulfills. There are 6 community projects within the consortium. I will be focusing on Sullivan County today. Our local partner is the county nursing home. These digital systems expand opportunities in rural communities through access to telehealth via telepresence robots, Zoom rooms, and telerehab systems. In rural communities, this expands opportunities for local clinicians and their capacity to deliver telerehabilitative services for their patients and residents. Opportunities can include virtual reality and augmented biofeedback devices, collaboration projects and research with UNH faculty and students, and additional opportunities for social connectedness among older adults. Potential programs and treatments, depending on the digital systems provided, can include falls prevention, strength and endurance, pain management and distraction therapy, neuro rehab, cognition and memory, physical and occupational therapies, and stress and anxiety reduction. I'd like to do a brief overview of the 5 digital systems that we are using in our project. The first system is the telepresence robot. The nursing home residents had a name contest, and it brought a lot of interest and enthusiasm. His name is Sully, after Sullivan County. Specialized telehealth consults, COVID-19, and social connections with family members that aren't able to visit in person are some of the advantages this system brings to residents. They also use it as a door greeter. Dietitians are using this remote patient monitoring scale at our site to monitor cardiac and diabetic patients and those on restrictive diets. Patient readings taken with the scale are synchronized in near real time with both a clinical portal and with their EHR/EMR system. In the digital portal, it alerts the clinician if there is a significant weight change. The augmented biofeedback system enables functional fine motor fingers and wrist exercises for rehabilitation of the hand and wrist, as well as cognition with another sensor. The system consists of an ergonomic wearable glove and physical therapy rehabilitation software. The therapist can then work within the patient's movement ability. The movement biofeedback glove ensures that the patient is kept motivated and challenged to do intensive practice. It is used to help treatment of strokes, Parkinson's, MS, head injury, muscle weaknesses, and other fine motor, sensory, and cognitive impairments. The VR cognitive system offers over 100 immersive experiences in 360 degrees, designed to relax, distract, and boost mood. It transports users from their current location to a whole new world where they can explore cognitive and mindfulness activities, travel and nature experiences. The veterans especially enjoy the War Memorial Tour, which gives a history of all the memorial designs. This system is offline, so it doesn't need Wi-Fi, which is critical in rural areas when Wi-Fi is not always accessible. With online configuration, staff can access Real Connect to provide opportunities for social connectedness with the resident's family member or care team. This VR physical therapy system covers a range of therapeutic and wellness areas. Led by the clinician, immersive activities are targeted for therapy areas that are needed. This includes upper and lower body extremity training, core and balance falls prevention, cognition, activities of daily living, positive distraction for pain and stress management, and these experiences are all gamified to keep people engaged and to raise different levels of engagement with their therapies. Telehealth assistive equipment were available for our other project sites. Many of these are libraries or community centers. Our partner is the Sullivan County Healthcare Center, which is a 160-bed facility with an Alzheimer's and rehabilitation unit. They've just completed an $85 million physical building rehab and are in the process of moving residents to new rooms. We introduced each digital system in intervals as to not overwhelm staff. We then provided on-site training and technical assistance for each system. We're conducting a research project. Did these systems add to the quality of care residents were receiving? Finally, we connect UNH senior nursing students each semester with a project. The nursing home director asked if we could build a social environmental assessment tool that they could use to help select roommates for their new addition. The socio-environmental roommate assessment tool has gone through several iterations with various senior nursing student projects. Comprehensive criteria included temperature preference, cognition levels, personal routines, hearing parameters, social interaction, behavioral indicators, treatments needed, physical room needs such as a right or left-handed shower grab bar, and others. We're now working with computer science students to develop an app so that the criteria can be matched for roommate selection. Thank you so much for the award and recognizing the important work being done in New Hampshire. I look forward to answering any questions.